Yeah, hi, I'm Vimal Jain, and I reside next to Kim's, which is Secunderabad MG Road. Uh, on 25th of November evening, while I was on my regular walk, in the initial first half kilometer, I felt a big pain in center of my chest. Then immediately I was not able to walk, but somehow I managed to go home. And then we thought of visiting a local doctor, and we went to a local hospital, and then he took a ECG and informed that it is more of a gastric problem. So he gave some Penta 40 for us and asked us to take rest. And evening I came back home. I talked to my brother, who is a doctor in US. He advised me to take aspirin. I took aspirin and slept in the night without much pain, but some uncomfortable uneasiness was there. So in the morning, I had my regular bath and went to temple and came back home and thought of visiting to Kim's, some cardiologist who can advise me what is the real issue is. And that's where at around about 10:30, I visited Kim's, and I visited Dr. Rajendra Jain for a consultancy. And then initially he discussed with me all the symptoms which I had faced during the last 1 month. And the symptoms were like the day I was walking for 5-6 kilometers. Initial first minute, I used to feel some heaviness in my chest, which is in center of my chest, which is not to the left of my chest. But after that, I was comfortable. After noting down all the symptoms, Dr. Rajendra Jain also asked me about my family history, wherein I had my father who expired of a cardiac arrest at the age of 45. So taking those symptoms into consideration, Dr. Rajendra Jain advised me to go with the test ECG and angiogram so that we can identify the problem. So, and I also felt some uneasiness in my chest. So on his advice, we were immediately admitted to the ICU, and they started the procedure with the initial ECG. They took 3 times the ECG. Then they took me to an operation room, more of a room wherein they were able to do the angiogram. So during the angiogram, Dr. Rajendra Jain showed me on the screen that I have a blockage of 99% in one of the major valves. So he recommended that I should go for an angioplast with a stent. So because I believed in the doctor and the way he explained me, I immediately said, without much thinking, I consulted one of my home physician, who is also a cousin, who is also a cardiologist in Jaipur. So he also advised that we should be going ahead with the replacement with the stent. So immediately at the same spot, I decided to go ahead with a stent. So within next 45 minutes, Dr. Rajendra Jain, without much ado and without much pressure on me, he was talking to me while the whole procedure was being conducted. I did not feel any pain, and I was talking to Rajendra Jain whole of that 45 minutes, stating that everything will be fine. There is nothing major. We are just starting the process. And I was able to go through that whole 1 hour ordeal without much pain. And then suddenly he said, "Vimal, it's all done. Your stent is replaced and you're all fine." And I was much relieved. And I discussed the same with my brother in the evening, stating that, who is a doctor in US, had to tell him that these were the situations where I had to face, and I had to go with the stunt. And he was quite happy that I took the decision immediately. And I'm also very grateful to Dr. Rajendra Jain for conducting this whole procedure in a flawless and a painless manner, which itself is something very great, because once we talk of a heart surgery or a heart attack, it's like you see the moon. It was not the case, and I was totally as if I've come for my tooth decay or something, wherein they had did some procedure and I'm all fine. The nursing staff and everything was quite good. We are really appreciative of the infrastructure what KIMS has, which is really very good. Even the staff was very cordial and effective, and they took care of me very well. Yeah, from the day begins with my dress change, the bedsheet change, giving me a dry bath. Everything was immaculate. And I think this is roundabout today is we are almost 10 days post the operation. I'm here and trying to describe the ordeal what I have gone through on 25th and 26th when this whole process was done. I was discharged in next 2 days, and right now I'm carrying on all my activities from home. I'm not going to the office but working from home, and it's all fine. Thank you once again. Thank you.